We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. So today we have with us Jane Draper, who is a past patient of ours, and she has a unique story to tell. We invited her on because she went through a unique experience and had a knee injury, and we wanted her to tell it and the things that she went through. So welcome, Jane, to the podcast.
Thank you, Brad.
It's so great to have you on.
Thank you. It's good to be here.
Jane's an absolute pro at this, so we're excited to have her on.
When I pulled up today, it was a little strange because I was coming here 3 times a week and then 2 times a week and then once a week. And then now it's been 2 or 3 months. And so I was like, I miss everybody.
Oh, I'm glad it was that. I'm glad it wasn't like PTSD. You're like, oh no, coming back to the place where I was getting all my rehab. But I'm glad you had that feeling this morning. Tell us about what happened to your knee.
I was skiing, got cut off, and didn't have time to avoid the person that cut me off, and we collided, and I ended up with my right leg behind my body.
Was this a little kid or was this an adult? What was the collision like?
Well, my brother told me to say that I was doing, a double backflip.
Oh yeah.
But
For the record,
it was probably an 11-year-old kid.
It's just a little kid that just ran into you.
Yeah. I thought I was a good enough skier to avoid the collision. I tried to.
Yeah.
I think if I had it to do over and I could think fast enough, I would try to just sit down instead of having my leg end up behind me.
Yeah. So what happened is that you just collided together. And then did you go over the top? Did he hit your knee? How did that happen?
No, I was surprised that I had hurt my knee as bad as I hurt it, because I basically just fell and it didn't hurt. And after about a minute, I got up and tried to put weight on my leg and couldn't put any weight on it. So had to call the ski patrol, go down the hill in the toboggan, which looks really fun. It's not.
My daughter told me that she didn't know what a toboggan is. Define a toboggan.
A toboggan is like a sled that a person can lay in.
And is this sled comfortable?
No, they really
Describe
need some.
it to us.
They really need some bubble wrap or
some padding,
some padding
maybe
in
some
there.
Suspension.
Yes, yes. It's not comfortable. The good thing is that the good thing and the bad thing is that they put a cover over your head. And so it's a little claustrophobic, but it's good because it helps the snow not to get all over your face.
It's a little warmer. It's
Yes.
like a blanket wrapped over you.
And then you get literally skied down the hill by someone else. The toboggan is attached to the good skier, and you go down the hill that
Shimmy
way.
your way down.
Yes. Yeah.
Okay, and so you got down to the bottom of the hill, and then what happened from there?
And then I went into the first aid tent, and they just let me sit in there until I could get a ride to the hospital.
Okay.
And then I got a ride to the hospital, and they made sure that nothing was broken. And meanwhile, it was difficult to go to the bathroom or go up and down a step. My brother and my son were living with me at the time. And so they would give me piggyback rides up and down the steps, because I have about 5 steps in and out of, my house. And even getting up to go to the bathroom. And then, of course, they gave me crutches. But what I didn't realize is when you're on crutches and you're trying to make a sandwich, it's really hard to carry things when you're on crutches. So I was pretty distraught.
Those are little things that we don't even think about, right?
No, I was distraught. So I finally got into this a doctor that was an orthopedic doctor that was, I assumed that they were going to do surgery until I met you. The doctor told me that I had torn my ACL, my MCL, and my LCL and meniscus, which I didn't even know I had an LCL. I don't even know what that is, but I tore that too.
Yeah, LCL is your lateral coligament. So it's on the outside of your knee.
Okay.
Your MCL is on the inside of your knee. So it's a little piece of connective tissue that attaches the two bones together.
Yeah.
And then your meniscus is inside the knee and it stabilizes the knee.
Yeah.
And then the ACL is in the center and it holds the tibia and femur from shifting forward and backwards. So there's all these different ligaments. So you were told that all of those were torn.
All of those were torn. The
were completely torn through. Was that your perception?
The radiologist wrote a report, and then the emergency room doctor called me and read the report to me. And that report, after the MRI, said that I completely tore my ACL and my MCL, and that I partially tore the LCL and the meniscus. So
tell me what went through your head as you received those results.
I started crying. I was really sad. I mean, it had been 4 days at that point, and I knew that something was really wrong because I wasn't able to walk or put any weight on it at all. Not even like I have just one step to get into my shower, and I couldn't even, I had to sit on my bottom and scoot into the shower and then stand up on one leg. And how old are you? You look like you're 40. I mean, just give us a general idea where you're at age-wise. Thanks, Brad. Let's see, at the time I was 62.
62. So 62-year-old skier.
Yeah.
Just going through this. This injury is tough even as a teenager. As a 62-year-old, this is tough stuff. Yeah. And had you had injuries in the past?
No.
So this is the first injury that you had?
No. I think the orthopedic doctor thought I might need to see a psychiatrist because I was just sitting there going, this is the worst thing that's ever happened to me. But that's what it felt like. It felt like the worst thing ever. And another part of it was I had a trip planned that I was really looking forward to. And I thought, there's no way I can go on this trip. Well, maybe if I have the surgery and then I can get better. But they said they wouldn't do the surgery for a month. And then that didn't give me enough time to recover and go on the trip. And
remind me of the trip that you had planned, and how long did you have from the injury to when the trip was scheduled?
So the injury happened on February 15th, and the trip was planned for May 4th. So I had a little bit of time, but...
So you're thinking, if I get surgery before, go through the rehab, I should be good to go by then.
Well, I didn't even know about physical therapy until I went to Dr. Cooley, and he said, we need to get you in physical therapy. And the thought that went through my head was, oh yeah, what is that going to do? Just get me into surgery and let's get this thing fixed.
Yeah.
And then I met you, and you told me, Jane, if you have surgery, you're not going to make it on the trip. But if you don't have surgery, I'll have you ready for the trip. And the other thing about the trip is that it was a hiking trip. So it wasn't just going on a trip, but I wanted to be able to hike.
Yeah.
And I knew one of the hikes was 3 miles, one was 4 miles. I thought that the long one was 7 miles, but then realized it was 10 miles. And you told me, I'll have you ready for all of those hikes. Maybe not the 10-miler, but I'll have you ready for the others. And that
was a bold promise. I don't remember that.
I didn't believe you. I didn't believe you, but you were all I had.
Well, I'm glad you held on to that hope.
So I did everything you said. And I did really well for a couple of weeks, and then pushed myself a little too hard and had a setback. And it affects you mentally when you have that. It really gets you down. And I had to get through that mentally and just keep going. When I came in and talked to you, you were just like, Jane, this happens. Come on, get back on track.
What's really interesting about your case is, those wouldn't be the recommendations I'd give for anyone that came in off the street and tore their ACL or MCL. What was interesting about yours is when you test the ACL, the MCL, and the LCL, and the meniscus, they're all feel intact. So they feel as if they are still there. And, the muscles could be guarding to stabilize it. But there are a lot of people that can survive just fine without an ACL. The hardest part is that if we choose to not get surgery and is truly torn completely apart, that tissue can essentially not get the nutrients that it needs, and you can never go back and repair it. So you end up using a cadaver graft. So I shouldn't say you can never go back. You can go back, but you just got to use a different tissue to actually repair it. The reason I gave you those recommendations is because yours was very intact. And sometimes on MRI, it shows that something could be torn through, but it's very translucent when you see the image, and sometimes it's not as accurate as we'd like it to be. It's technically the gold standard for being able to see those sort of tissues, but sometimes they'll get in there and realize, oh, your ACL is not, it's partially torn. Oh, it's not completely torn through. So sometimes the imaging gives us inaccurate information. But the nice thing about yours is we knew through examination that, we could prepare you well for the surgery, and that most people get back to full capacity before surgery and then still opt for the surgery. In your case, you decided, it feels good enough to where I don't want to get the surgery, and that's where we want most people that tear their ACL, is we want them to feel so good that they get to make the choice. And I'm not saying I recommend, doing the surgery or not doing the surgery. I just want to give people choices. And we get you as better as we can, because what happens is if we get you as good as we possibly can, then if you end up opting for the surgery, going for that surgery, then all of a sudden you're so much better prepared for it, and the surgery goes so much better, and the outcomes are so much better. Mm-hmm. And that's what we love about giving people options and going through therapy before, because there's the initial trauma that essentially swells up your knee, which it causes pain, and then you can't move it, and it kind of escalates, right?
Right.
And a lot of people think, like, what's PT going to do for me before surgery? It's going to return it back to almost feeling normal.
Yeah.
Right? What we don't really love is if there's not good intact ligaments and you don't have a lot of muscle control and stabilization of the knee, then it can translate and tear other things. That's our biggest, the thing that we worry about the most.
Yeah.
But that's why yours was so unique, because we thought like everything was torn, but when we test it, everything's pretty secure. And you're doing really high level things. We'll kind of skip forward in the story right now, and then we'll come back. But what are you doing now?
Well, I didn't think I was going to be able to play pickleball, but my friends asked me to play, and I was like, okay, mentally I prepared myself to lose. And
but you're a very competitive person.
Oh, not at all. And just got in there and played and had a great time, and then played the next day, and then played the next day because I had so much fun. Yeah. And now my arm and my upper arm and lower arm.
You did a little too much.
I did too much again. So now I'm not really worried about my knee as much as my arm is hurting me more than.
You just missed us, didn't you? You wanted to come back.
Oh, how'd you know?
And so you remind me, you're a real estate agent, correct?
Correct.
So that's where the competitive nature comes from, probably. I mean, that's probably been a part of your whole life. So the question is, did you win the pickleball?
I did.
Okay.
I won
you still dominated.
most of the games. Most of the games.
That's important.
But now my partners had a factor in that. Like if I played with a partner that
that was
as bad as me, I lost. If I played
so you needed someone that was better.
Yeah.
That could hold you up. I love it. Tell me about the trip and how the trip went. You ended up going on the trip?
I ended up going on the trip, which I thought was a miracle that I was able to go. But I was able to go. I had a great time. My knee was great. I took a brace just in case, and a wrap, and things that I thought I might need, didn't need any of them. I was just careful, and I was able to do all the hikes except that last one that was
the 10-miler.
Yeah. And I mean, I probably could do a 10-mile flat hike, but because it was rocky and uneven surfaces, I was more mentally nervous about hurting my knee again. I think I could have done the 10 miles. It was just too hard of a hike.
Yeah.
Yeah.
So tell me about you talked a little about the feelings that you had in the beginning. Tell me about the ups and downs through therapy, and what advice you would give yourself if you were at the beginning. If you were looking at yourself right now and it was at the beginning stages, What would you say to Jane at those early phases?
I would have, I mean, if I had all of that knowledge in the beginning, I would have called you sooner.
How did you end up getting to us? Dr. Cooley referred you to our clinic. Is that correct?
Dr. Cooley said you have to get into a physical therapist. And I called probably 10 different physical therapists, and your business was what took my insurance.
Mm-hmm.
So
you found it and you're like, we better go there.
Yeah.
And it was close to home. You live in it.
Yeah, I live in Daybreak, which is just a few miles away.
Yeah, that ended up being perfect.
Yeah.
So tell me about the ups and downs through rehab, what you experienced, what you wish you would have known, what you know now that you didn't know before.
I am still amazed that such small movements can help my muscles to get stronger. Just standing a flat foot, raising up on my toes, holding it for 3 seconds, going back down, just the smallest little exercises got me so strong.
Yeah. And sometimes it doesn't take much, right? It's just figuring out what is the actual problem that's happening. Where are you not getting that stabilization? And then we correct those small things, and then we start piecing everything together. Was there days that you were just like, oh, you had that setback? Tell us about that setback. 3 weeks in, what was it about?
Yeah.
Where you pushed it a little too hard?
Once I started physical therapy, mentally I was okay after that because, well, probably a week into physical therapy, when you told me that I'm going to have you off those crutches in a week and I'm going to have you off of that brace in 2 weeks, I didn't believe you, but I had to trust you. And we did it.
Yeah. And what advice would you have yourself? Looking back at that, you said you lacked the trust, but you were like, that's all I got. What would you say to yourself now?
I would have called you sooner.
Right, go back to that. Called you sooner. Get in sooner.
I would have called you sooner.
How long between you the injury and when you got into therapy? How long was that?
It was about 2.5 weeks.
Okay. Yeah, for the most part, we like people to wean off of crutches with good walking mechanics by 9 to 12 days.
Yeah. And
we use a lot of research to back that up, but we don't want people to wean off of crutches too soon either, right? Because crutches are supposed to help you manage pain, and we want you to walk very normal. So there is a process and step-by-step procedure that we follow, but that's a general timeline based on, what happens to your knee. And it's kind of tricky sometimes because, in your case, you had a trauma. There could have been a lot of excessive bruising, even bone bruising, which is, really painful. It feels like a broken bone.
Yeah.
But you bounced back really quick. Your body healed and responded really well. Tell us about a few of the biggest challenges that you faced throughout. You talked about the crutches and being able to get your sandwich from the counter to the table. What other things that you didn't think about until you were on crutches and in pain?
Well, this is kind of personal, but just going to the bathroom. I wished that when I built my house, I would have upgraded the toilets because I have low toilets and that was hard.
That's why you stay so young.
It was hard to get down and it was hard to get up. When going to the bathroom is hard, it affects you mentally. And just for a while, I was hopping around on one leg, and then that knee started hurting. And I thought, okay, I can't have...
So you had like a compensation pain where you overutilizing the other one, and it was getting a little tired, fatigued, and now injured.
Yes. And so I knew I had to do something to strengthen both of them and not have two bad knees,
What did you feel when you were like, I can't even get to the toilet? What were some of the things going through your head?
How am I going to work? What am I going to do? My kids are going to get really tired of taking care of me.
So kids were there, family was there.
Yeah, my husband passed away 2 years ago, so I didn't have my husband to take care of me. But my son was home from his mission and living with me, so I did have him, and he's big and strong. And for a while,
you just throw mom on his shoulder.
Oh, he would literally Mom, hop on my back.
Oh,
I'm going to hurt
that.
you. No, hop on my back. And I would hop on his back. This was to go to the doctor.
Yeah.
When I had the crutches and the brace, I just couldn't figure out. I could not put any weight on that leg at all. I needed, they gave me a brace at the hospital, but it wasn't a good enough brace. And then once I got a good enough brace, and could put a little bit of weight on it, I learned how to go up and down the steps. And that was the biggest challenge, was going up and down steps. The challenges were simple. Going to the bathroom, making a sandwich, going up and down stairs. Simple things that I couldn't do.
And simple things we take for granted, right?
Yeah.
Yeah, there's just things that we don't think about, and then you start to do those, and it just kind of becomes debilitating because you just get stuck in this cycle of, oh my goodness, I can't even do the simple things. I'm gonna wear out my family. I'm gonna wear out my friends. They're not gonna want to help me anymore, and then I'm gonna lose my job. Like it just literally just escalates, right?
Yeah. Or how am I gonna do my job? Because, I mean, being a real estate agent, I have to be able to go up and down steps. There's not very many homes with
you're showing houses.
0 stairs, you know?
Yeah, you're like, why don't you just show yourself the upstairs? I'll be down here when you need me.
Well, I couldn't even get in the front door. How do I go up the steps to get in the front door?
You're just going to show yourself the house. I'll be here if you got questions. A couple years ago, I broke my hand and my wrist, both sides. And as a therapist, I had the same thoughts. I thought, how in the world am I going to do my job?
Yeah.
There's so much that, people rely on me, both my patients, my staff, there's just so much that's relying upon me. How am I going to do this? And I went through this panic phase of just like, oh my gosh, this is so overwhelming.
Yeah.
The biggest thing that I learned as I went through this experience is you just take it one day at a time, and you rely on the people that love you. It's only a short window.
Yeah.
It's usually the first week. You feel like it's going to be forever. And then you start weaning off of needing help 2 to 3 weeks, depending on the injury. But reliance upon the people that love you is so crucial. Tell me how your relationship was influenced as you went through this experience with you. It sounds like your son mostly.
Yeah. Yeah. I thought, oh boy, is he ready to get married? Because taking care of your mom is really hard.
It's a good prerequisite.
But he did a really good job. So I think he is ready to get married.
Oh, that's great. So it put him through the refiner's fire to make sure he was ready to get married.
Exactly.
Good marriage prep.
Yes.
I love that. Do you feel like you saw your son differently through these phases?
Yeah, I think when you have a challenge like that, you have to dig deep. And my son's name is Riley, and he dug deep and had to make his mom food and help me do all the simple things. Yeah.
We don't realize, how hard it is on you when you're injured, but we kind of forget about these caregivers sometimes. And, the ones I really get concerned about is the caregivers that are doing it long term. The excess stress it puts on their life, if it's 3 weeks, yes, it's inconvenient. But most of these people they love you so much and they want to help you, and, they want to care for mom and make sure she's okay. And, I'm sure that was such a good experience between you and him. And even if you had to have him help you off the toilet, but
yes, it was a good experience.
That's great.
Serving people helps you love them more.
Yeah, so. Absolutely. Sometimes we forget that. And as we're going through challenges like this, I think sometimes we forget to ask, and we take away the opportunity for someone to actually help us, which gives them, so many good hormones and connection that happens, because you're in your most vulnerable state. And sometimes we're just like, oh, I'm good. They'll ask you like, what can I do for you? And you're like, oh, I'm good. And the biggest thing I realize is, if you're a caregiver, just say, how can I help? Or just do it. Just see the need and just go help. Because most people just are not going to ask for help, but you just show up, whether it just be connecting with them, or did you have anyone through this experience that just jumped in and helped you?
Yeah, my daughters.
Tell me about it.
My oldest daughter is really good at it, and her kids are a little bit older. And so I can always count on her to think about what I need even before I know what I need. And she and her husband were there for me. I have 6 children, so I don't want to leave any of them out.
They all helped.
But they all helped.
It wasn't just 5 and one loved.
It was a joint effort. Everybody pitched in. And
That's so
neighbors,
great.
as soon as like my neighbors heard about it and people in my ward at church, I had, meals and just, yeah.
Tell me what all of that service that people gave you, what did it mean to you?
It made me feel very loved. Yeah.
Sure.
I probably needed it because it's hard mentally to go through an injury like that and not be able to do a lot of just simple things. It's hard.
It can definitely be a challenge, right?
Yeah.
And I will say you're probably felt so loved, obviously because they love you, but you probably reciprocated that at some point. That you had served all those people in the past, and now they just the law of reciprocity, which is they want to reciprocate that back to you. They want to come give you what you gave them.
Yeah.
And
I like to think that.
I like to give myself that credit, but
I like to think I'm as good as them.
But I just love that when people are down and they are going through these challenges. I don't think we talk about it enough.
Yeah.
People that jump in and how meaningful that is and how special you feel as they're willing to help you in your most vulnerable time. Because injuries are not easy. They're very, very challenging and mentally, physically, emotionally, just exhausting. Tell us about how often you went to therapy and what your therapy experience was like.
The foundation therapy is awesome. I loved coming to therapy because I immediately saw results. And Brad, you're great. And I really love Piper. Yeah. She was awesome. She was so good.
So I work specifically with a PTA, and you worked with both me and Piper through your experience.
Yes.
Tell us about that experience. What it was like. You saw results, it sounds like, as you were going. So you saw those immediate results. So it was gratifying. It made sense. So it built upon itself, right?
Yeah.
Tell us the biggest challenge in therapy. What was kind of the biggest challenge for you as you went through that rehab experience?
The biggest challenge in therapy was making sure that I did what you said. Taking time every single day to get the sheet of paper that you gave me and make sure that I did every one of those exercises. And the consistency is the hardest thing.
Yeah, being super consistent is super important. Tell us about what your experience was like working in the healthcare as you came into the clinic and as you worked with each role. What was that like? What did you like about that?
One of the things that I like about foundation therapy is everyone is smiling. Everyone has a smile on their face. They remembered my name. Every single person that works here remembered my name and said, "Hi, Jane," when I came in. And when you're down and out and already feeling bad because you can't do a lot of the things that you normally do, to be able to walk into a clinic and somebody to say, "Hi, Jane," and smile at you is huge.
Yeah. Tell me, do you get that experience in other healthcare facilities as you go to different doctors' offices and dentists and things like that?
Not always. I mean, sometimes, but not always. And most of the time they don't. If they say your name, it's
because they're calling you.
Yeah.
Tell us about what you experienced, maybe in your experience here, and what we could do as a healthcare team to improve. This podcast is called the Healthcare Revolution. It's all about revolutionizing the team working together cohesively and improving the patient experience. What suggestions would you have for healthcare on how we can improve your experience?
Boy, that's a hard one. I think you guys do a really good job. I appreciated Piper calling me 2 weeks ago after I graduated from physical therapy, and she called just to check on me.
Hey, tell me what that meant to you. Like, how did it feel as a patient that had been here to get a checkup after you discharged?
Oh, it made me feel like you guys really care. You care about me being able to get back to my normal activities. And you guys also pushed me to start running again and maybe ski again. I'm not sure. I'm still a little nervous to ski again.
We better work on that.
But you guys pushed me to, and one of the things that I liked the most is you and Piper would always say, "You can do this, Jane. You can do this." And sometimes I didn't think that I could hop. And you said, "Hop." And I hopped.
Yeah, and the thing is, we don't just guess, right? We don't just say, "Yeah, you can hop now," right? There's things that we measure to determine if you're ready to hop, and now we know that you could already do it. The only barrier is just mental. That you need a little extra push. We've measured everything to determine you're ready. Now we're confident that you can do it physically. Now you just got to get over the barrier of doing it.
Yeah.
So
funny story is, one of the things that one of the exercises that you gave me to do continually to keep strengthening my knee is just to stand on one leg, my
injured leg,
thank you, and just bend down and touch my toe. And so I'll just do that randomly anywhere. And I was doing it when I was at my mom's house, and she looked at me and she goes, "What are you doing?" And I said, "I'm just doing my physical therapy." And she goes, "That's physical therapy?" And I said, "Yeah, why don't you try it?"
We there's some new vital signs coming out. So vital sign is something like blood pressure or your heart rate. That's something that we track that help us determine your level of health. And there's two vital signs that are coming out that we are measuring more regularly and are happening within physicians' offices and in clinics and things like that. And one is grip strength. Grip strength is directly correlated with a word called mortality. So the higher grip strength you have, the less likely you are to die. So that's what we mean by mortality. So it's a direct indicator of where you lie on, the likelihood of passing away. Stronger humans are harder to kill. And it's just, there's such a correlation. We're using that as a tool now. And the second one is a single imbalance test. Because a lot of people in their older age, in their 70s and 80s, they fall and break a hip. And that's one of the biggest indicators for passing away is an actual trauma. So it's a balance issue.
Yeah.
So we're realizing single imbalance tests. So, to go down, it's called a single leg RDL, Russian deadlift. You go down, you're standing on one leg and go down and touch.
Yeah.
That's a hard skill. It's not just standing on one leg.
Yeah.
And as a 62-year-old, that's incredible.
Well, my mom's 87.
Can she do it too?
She couldn't. But I said, "Mom, it's a lot harder than it looks." And I said, "Why don't you start by holding on to because remember, I started by holding on to the side of the table, and I would do it kind of holding less and less, as the table being my anchor. And eventually I was able to do it. So that's what I told my mom to do.
I love it.
She's 87.
And the thing is, balance is just like a muscle.
Yeah.
The more you work on it, the stronger it gets. A lot of people think that they lose their balance just because they're getting older. No, you're losing your balance because you don't do what a toddler does, right? You're not bouncing off walls. You're not jumping up and down. You're not jumping on a trampoline. That's how we develop a lot of that balance is by working on it and challenging those systems. So kudos to you. That's awesome. We should get you on a billboard and have you video doing that at 62 years old. 62-year-old ski accident.
I didn't realize how hard it
ACL.
was, but that's my one exercise that even if I don't have time to do anything else, I do 15 of those every single day.
That's so awesome. I love it. Well, any other last advice for patients that are going through these hard times, or maybe someone that's just not really sure about going to PT? What would you tell them?
I have a testimony of physical therapy now. It is the best. I don't know what I would have done without it. I might still be on crutches or still have the brace. So I love it. Just the simple little exercises, being consistent every day doing them. And I'm going to keep doing them my whole life.
That's awesome. And, the biggest thing I love about physical therapy is it is a part of the medicine, the Western medicine model, but we don't use any kind of opioids or any injections. It's purely just using your body and learning from what it's telling you, and then slowly challenging it to change the mechanisms within the knee. So whether it's a ligament, strengthening it, or getting more blood flow to it, or strengthening around the knee to get more stability. There's so many things that we can do just with the normal, natural healing process, that we shouldn't just jump to these man-made things that we've done immediately. There is a place for them, and there is so important that we have these surgeries, so important that we have this medicine to help people, but there's so much our bodies can do. There's so much our bodies can do, and if we know how to challenge them, how to stress them appropriately, they manage well. And the majority of pain can go away with just normal, natural healing as you appropriately stress different tissues in your body. And that's what we do in physical therapy, is figure out what's the appropriate stress. If I was to put braces on your teeth as an orthodontist, the stress that they put on those braces determines the outcome of your teeth eventually. Right. So it's a certain amount of stress over time is what makes the change. What you just told us is the importance of consistency over time. You were super consistent with your exercise. You saw the results along the way, and then you saw a long-term outcome, and now you're playing pickleball. And that's what physical therapy is all about, is doing those things consistently over and over.
Yeah.
So thank you for joining us on this podcast. Thanks for being willing to share your story and be vulnerable. And it was such an incredible experience to see you through it. You're so optimistic along the way and so fun to work with.
Thank you, Brad. And thank you for getting me ready for my Greece trip.
You're welcome. I'm glad you had a great trip.
That was the best.
Well, thanks again for joining us on the podcast. We appreciate it.
You're welcome.